Ellie, give us a sense of the mood in that room and another big point of tension there, which was the discussion about social distancing policies during the pandemic, in addition to what we just heard, which was masking.
Chris, this hearing is looking like it's starting to wrap up. The chairman is in the midst of giving his closing remarks, so we're keeping a lookout here just outside the hearing room for if we see Dr. Anthony Fauci come out. And certainly I have some questions for him after watching that, including the idea of whether it was worthwhile to be backwards looking and if that makes the United States any more prepared for any kind of next pandemic. Of course, that's what Democrats continued to drive at during this hearing. For Republicans, it was a lot of relitigation of the kinds of policies that we heard so many times in those initial months of 2020 and the pandemic, things like social distancing and mask wearing. Listen, for example, to what Dr. Fauci said when asked about the idea of 6 feet of social distancing becoming the policy. Watch.
It actually came from the CDC. The CDC was responsible for those kinds of guidelines for schools, not me. So when I said that it just appeared, it appeared. Was there any science behind it? What I meant by no science behind it is that there wasn't a controlled trial that said compare 6 foot with 3 feet with 10 feet. So there wasn't that scientific evaluation of it.
And certainly when Fauci says that, Chris, it sort of speaks to the reality of having lived through and watched policy be made during the pandemic, which is, of course, the idea that this was an unprecedented public health moment. And the fact that Fauci is now testifying about, well, 6 feet wasn't peer reviewed versus 3 feet, that all speaks to the reality of policy making in real time during something as fast moving as the COVID pandemic. Of course, that wasn't the only thing that he was pressed on. And you watched the ways that Democrats in turn tried to give him every opportunity to say, okay, did you clarify that enough? Were you able to speak on this enough? Because at various points, Republicans would ask questions and then say, you know what, I don't need the answer. I have more questions to ask you. Both sides really sticking to the political talking points that we have seen on this over the course of the last several years, even as Dr. Fauci is really the person that this committee has been gearing up to talk to for the entirety of its existence. Of course, this is a subcommittee that was created to investigate the coronavirus pandemic. Now we're seeing, of course, what could be one of the main hearings of this subcommittee actually looks like. And the question that I'm really interested in asking Dr. Fauci when he comes out is, are we more prepared for the next pandemic? Because in talking to several Democrats, they feel that this committee has not spent enough time on that, and instead they've been too backwards looking, Chris.
So I'm going to keep you for just a second, and we'll see if Dr. Fauci comes out or anyone else who you want to talk to. But for a nanosecond, it looks like this might actually be something that, on paper at least, Allie, both sides could look at how do we make sure we do better the next time? Because you had 2 doctors who are both members of Congress, one a Republican, one a Democrat. That seemed to be the goal here. Was it inevitable that it was going to go off the rails a little bit, or maybe a lot of it?
I think it certainly seemed that way, especially when the committee hearing began with a warning from the chairperson saying, hey, just a reminder, don't attack your colleagues in a personal fashion, hearkening back to the last committee hearing that we saw with Congresswoman Marjorie Taylor Greene in it, where she got into a war of words with Congresswoman Jasmine Crockett and Congresswoman Alexandria Ocasio-Cortez. That's not far from mind up here on Capitol Hill. Most lawmakers on both sides of this building said that they didn't think that that was the best way for Congress to be represented in a wide-scale way, and certainly those clips were making the rounds. But one of the things that we saw was Congresswoman Marjorie Taylor Greene be one of the central figures that had a lot to say, even refusing at one point to call Dr. Anthony Fauci a doctor. And I'm watching some folks come around the corner here as we try to get ourselves into position, and our cameraman Manny's going to walk with me down the hallway so that we can see Dr. Fauci himself and just ask him those questions. But look, I think in this Congress, one of the things we've seen is committee hearings, especially those that are still so partisan and political, tend to devolve into some of the moments that we saw here, Chris.